Hi, I'm Karen. I've been working with the NHS for over 16 years as a healthcare professional. I'm really interested in finding out more information about prison healthcare. What can you tell me about the Offender Health Service?
So Bristol Community Health caters to 5 prisons local to Bristol, and we work with allied partners to provide holistic health care under the Inspire Better Health partnership.
And we've got 4 different teams within each of the prisons: planned care, urgent care, substance misuse and medicines management.
What do the teams do on a typical day?
So substance misuse is an integrated service made up of a clinical and a psychosocial team, and collectively we manage the needs of patients who have substance misuse disorders, and what that means daily is supporting them in their initial detox with the management of their withdrawal, and then continually then throughout their sentence supporting them in group therapies, so we're optimising the opportunity of them not relapsing then after release.
So I work within medicines management. I'm a pharmacy technician, so I work alongside nurses and HCAs. We administer the medication to the offenders on twice a day. Depending on how they've been risk assessed, we can give it them in possession, or we have to supervise if there's potential for diversion, because medicines can be used as currency within prisons. We also do compliance checks to make sure the people are getting their medication safely. And also liaise with the other healthcare professionals to ensure that they're all getting the medication.
I work within the urgent care team. We have quite a varied role within urgent care. Our main priority is to attend to any of the emergency calls that may come around the prison. That can vary from somebody falling over and bumping their head to somebody taking a drugs overdose or having a cardiac arrest. We also work closely with medicines management team and the planned care team as well, also mental health services. By doing that, we're able to give a more holistic care approach to the care that we're offering. We also do the new reception screenings, so when new offenders come into our service, they have to be screened so that we know where we need to send them to for appropriate help.
In the planned care team, we work just as we would in a GP surgery, so all of the services that are in the GP surgery that the nurses provide, we provide those. So we screen for bloodborne viruses, we do sexual health clinics, we manage people's wounds and dressings, and also long-term conditions such as COPD or diabetes, so those checks and patient support and advice around managing your own long-term condition.
What kind of jobs are available?
There's plenty of opportunities within the offender health setting. You could be a nurse. Nurses work within the urgent care department. They also work in planned care, within the medicines management team and within the substance misuse team as well.
And paramedics are also in the urgent care team as well.
You've got pharmacy technicians, pharmacists.
And there's also plenty of opportunities to progress into management as well. So there's head of healthcare, deputy head of healthcare, and then clinical leaders of each of the 4 teams as well.
And why would you recommend working for Bristol Community Health?
For me personally, it's about the opportunities that are available in relation to development and just the vision that Bristol Community Health have. I believe in their values. They're a very strong organisation. And the people that we work with are one big team, one big family, really.
And I'd agree with David that I feel since moving to Bristol Community Health, I really appreciate the emphasis on learning and development, and I feel really valued and invested in, not only in my learning as a clinician, but as a manager as well.
We're a social enterprise, which means that we give back to the community. We're also employee owned, but also we have the same benefits as people in the NHS, so we're aligned to Gender for Change, and so pensions and pay are set within that same framework. And it's also a flexible organisation, so we've got a family friendly policy, so BCH recognises that we've all got a life outside of work and works to support us with that too.
Right, okay.
I also think that working for BCH really does they push your development, so whatever you want to try and do, they'll always support you in anything you do. I also think it's good that they like recognise like your achievements. So like they have an annual Boscas where they'll give awards out to the colleagues who have
Gone above and
Yeah.
beyond.
Yeah.
So you're recognised.
Yeah, yeah,
That's
absolutely.
really good, yeah.
Yeah.
They're very forward thinking as well. They've recently developed a new social network, if you like, for staff called Workplace. So everybody is within touching distance really from the chief executive right down to the colleagues that you're working with. So there's always support there if you need it. I find that very useful as well.
Yeah, it's really reassuring to know that you're not alone, that you kind of feel part of a team, really.
Yeah,
Definitely.
Yeah. And why do you like working in offender health?
It's just a really diverse and dynamic environment, and what I really enjoy about it is that the majority of our patients experience in the community such barriers to healthcare. So it's really rewarding to me to be able to provide the ongoing and specialised interventions and see them through from admission to discharge. There's just no other environment quite like it.
I really enjoy working for Offender Health because no 2 days are the same. You don't really know what is going to happen that day. It's nice to see that the patients, who some of them are quite vulnerable, that they can actually, you can see yourself making a difference, even just a small difference to someone just for one day.
For me, it's about the consistency. You get to know the patients that you're working with. That a lot of them can be there for a long time. So you build up really good relationships with them, and you get to see them come in, particularly not in a very good state of health, to leave in much fitter and well. And it's also the environment. The environment is very safe. I feel very safe there. It's controlled, and I think a lot of people might have a preconception that actually it's quite a volatile place to be in, but actually it's very controlled, it's very safe.
Tell me about your career path. How did you come to work in offender health?
So I'm a recently qualified nurse. And part of my training was to do a placement at a prison, which I had to apply for. So I had already had a vested interest in offender health. Whilst on that placement, I really enjoyed it. I joined the bank as a healthcare assistant, continued on with my training, and had a job lined up to work in a minor injury unit. But actually, I felt that there was more opportunity available and a better career pathway for me working within the offender health system. So I took the job when I passed my qualification.
So I'm relatively new to offender health. Before that, I was an advanced clinical practitioner in the community. So I then moved from the community to offender health to become the clinical lead, which is a new post. And so that was really exciting for me to take a new post on that hadn't been done before, to try and pull the knowledge and the practice that is occurring across the 5 sites into one and support people to have the same processes and things across all the 5 sites. So we work together as a team and we share the knowledge that we have in one site to another site.
Right, okay. What about you, Kirsty?
So I began my career in offender health about 4 years ago at a different prison in Wales, and that prison is a sentence prison and privately run and has about 2,000 patients there when at capacity. So I was there for a little while, was able to kind of progress very quickly, and then eventually moved over to Bristol. And what I really enjoy about HMP Bristol, what was new for me is that it's a remand prison. So I was able to see the kind of health needs that were coming in, especially with the difference in substance misuse. I've had lots of opportunity to develop myself since then, and I've moved from the team lead of the Medicines Management Service to the manager of the Clinical Substance Misuse Service.
And you're a pharmacy technician, aren't you?
Yeah,
So how have you progressed?
So I've worked in all sectors of pharmacy, hospital, community, within the military as well. And when this job came up, it just seemed a big challenge. It's quite, not a lot of people seem to know really about prison pharmacy, so I found it quite intriguing and wanted to just try it, and I've never looked back.
Yeah, because I'm in the same situation.
Yeah.
I work in aseptic services at the moment, so I've been there for 16 years.
Yeah.
and I really feel like a change because I'm working in a clean room environment. My routine is every day. I can tell exactly what I'm going to be doing at any moment of the day. So for me, it's really interesting to kind of understand what you do, because you're meds management, aren't you?
Yeah.
I don't have any skills at all in meds management, but I have heard that you can get trained in that with...
So when you actually go into the medicines management team, there's so many opportunities for further training. You also have a pharmacist who's always on call if you want to ask them any questions.
Yeah.
There's a lot of clinical supervision. There's plenty of training courses you can go on.
And I've also heard you can do the national accreditation in meds management as well in the prison setting.
Yeah, you can do
Yeah.
that if you wanted to develop into sort of like specialised areas like mental health, things like that. There's all types of training you can be doing.
Oh, okay, that sounds really interesting, because I'm very specialised.
Yeah.
So for me, it's really enticing to try and expand my career in that kind of direction. It all sounds very interesting, but I'm slightly worried about my safety.
You've got no reason to be worried about your safety whatsoever. In fact, I probably feel safer in the offending environment than I would working out in the community. It's very well controlled. We have keys that we carry, and we get trained on how to use them appropriately and what they're for. We also carry radios as well, so people know where we are at all times. There's officers that will escort you around the areas if you need to, and there's lots of risk assessments done and put in place so that you're never putting yourself in a vulnerable situation.
And Bristol Community Health is working to ensure all of our staff safety across all of its services, and we've got a specific health and safety team that audit and ensure staff safety at all times.
Okay, so when you're on the wings, do you have like a team with you, or like somebody working with you, or do you ever work alone? And
You should never be
there.
working alone. You should always be in pairs at the very
Right,
minimum.
yeah.
And it's about you thinking about your own safety as well. So you're encouraged to work with somebody else. You're encouraged to let the officers know if you are on a wing. Not all prisons work that way. I believe in some other areas they will bring the patients to you, so you're already in a nice secure environment. Where I work, we do go out onto the wings, but again, it's just following all of the security training that you get before you start at the prison. Providing you follow that, you'll be fine. And ultimately, it's just about treating them with respect. You are going to come across grumpy people. You're going to get that wherever you go, but ultimately, it's how you deal with it that minimises your risk.
And we've got training to support you to how to de-escalate, how to manage difficult conversations, and also there's training that you'll go through that the prison provide as well around your own personal safety. So there's lots.
Generally, the patients treat us with a lot of respect, because
Absolutely, yeah.
being healthcare, they generally come to us for any vulnerable needs, so they're generally receptive to our interventions and our help, and they're often very grateful for that.
What's the best thing about working in your team?
I think the best thing that I find is that, one, we're all a big family and you always know you've got support from everybody. It's a real multidisciplinary team, so at lunchtime we all have a handover where everyone from each department come together and we can actually share experiences from that day, and if anything needs action in, then that's the time then we can actually hand over different things.
For me, it's definitely the peer support that you have, not just within your own team, but from other teams as well. So if there's anything that you need affirmation on or a second opinion, someone's always on hand to support.
And working, like you were saying, Alison, in a multidisciplinary team, really and truly, with other providers as well, so the GPs or the mental health team and things, all being available to have a discussion, or the psychosocial team, to be able to really have a good discussion about the holistic care of a patient is really special.
Yeah, I would agree actually. You build up fantastic relationships with both the patients and the people that you work with. For me, the feedback that we get from our patients in relation to the care that we're providing really gives our team a buzz. We really enjoy and strive to make sure that what we're doing is excellent, and we support each other with that, and we've got a huge range of different skills within our team, and we're very close-knit, yeah.
So you would say really that all the teams sort of combine as one big team really, that you're all sort of talking to each other
100%.
and
Yeah.
communicating across each team.
Yeah.
Absolutely. It wouldn't work if you weren't like that, you know. It's really important that everybody has mutual respect. We all have a really good working relationship, and you know, we're there for each other if we need it, really.
What learning and development's on offer?
So there's in-house training and support, which is either mandatory or specific to the job role that you're doing, as well as you can work alongside your manager to have a development pathway that you would follow over 1, 2 or 3 years. I'm concentrating on supporting staff on the advanced clinical pathway, and within that there's training in-house but also university courses to work towards a master's in advanced clinical practice.
Oh, that sounds interesting. So can you choose your own pathway, or is it something set for you within your job role?
So it's set within your job role to a degree, but also there's opportunities to have a discussion with your manager, and if you and your manager both feel that it would be beneficial to your job and to you, then you can plan something different.
I've also felt working within a pharmacy environment in a prison that I'm being able to do courses that I would never have even dreamed of doing out in community or in hospital. And also enriches your job as well. So like your smoking cessation, if you've got on one of them courses, it means that you can hold clinics, meds management, then you can actually help with reviews, things like that, which you wouldn't get a chance to do anywhere else really.
Plenty of opportunities
Definitely.
for CPD then.
Yeah.
I echo their sentiments. It's not just the opportunity for training and the variety of training courses. I really appreciate the culture behind it as well. So you never feel that you can't take time off to attend these training opportunities. You're constantly supported by your manager and the wider team to go off on these training courses, but then also to come back and integrate what you've learned in the team, and it just makes you feel more valued and more progressive, and it really helps in terms of the innovation of the service as well.
Why would you choose offender health over another community speciality?
For me, it's the variety of what you're seeing daily in terms of the patients and their healthcare. My experience in the community, for example, if you're working in a hospital ward, it can sometimes feel like you're very condition specific, but given the population in the prison, you have patients there from who are aged in their teens up to their 80s or 90s, and everything in between that. So you're responding to emergency incidents, or there's the management of chronic conditions such as epilepsy and diabetes. You're seeing patients there with substance misuse disorders and mental health conditions. So every day you're getting some aspect of all those in together, and so you're constantly learning and your clinical judgment is constantly being tested.
I think with it being quite a holistic approach to when you work in a prison, it's completely different from anywhere else that you can ever work. Everyone integrates so much, and it's all about trying to deal with a patient's physical, social and psychological needs.
For me, it was about, I've worked in the community a lot. I've worked in lots of different areas in the community, and prison healthcare as a rule is very much all of those areas under one roof. So for me, it was the best of all worlds. There's no particular area that I dislike, but I very much enjoy it all. So to work in a prison where you've got your continued care, you've got your emergency care, you've got your opticians, you've got your physiotherapists, and the referral pathways into that, you've got your GPs. So it's just nice to have everything under one roof. So there's always scope for opportunity, there's always scope for learning something different, and there's always an expert somewhere that can help you if you need that assistance as well. So that was my main reason for deciding to go down that route.
So you would say it's a very varied job?
Yeah, no 2 days ever the same.
Yeah.
And it's just nice to see that you actually can make a little bit of difference. And it's quite, with it being the environment you're in, you can actually see that effect happening like day to day, on a day-to-day basis.
Yeah, you must have a huge knowledge base of lots of different things going on as well.
Another thing is that we work alongside patients, so we're not judgmental. We involve them in their healthcare and their decision making around their healthcare, and give them every opportunity to be able to manage their health independently.
And I think they appreciate that through feedback that we get.
Sort of feel valued and positive.
We make every contact count when we see somebody, and that helps them sort of along their journey around their healthcare.
And it is part of that journey, you know, they're in there for whatever reason that may be, but actually the healthcare that you're providing as well also helps with that reintegration, if you like, back into the community, because they get their voice back. A lot of them may not have been in control of anything that they've been able to do with their life up until this point. So to sit with them and tell them that you care and that you understand and that you want to help make a difference with them really goes a long way.
So whilst there's the opportunity to kind of share and learn from other teams, there's just as much emphasis to specialise in certain areas as well.
What do you think makes someone successful here?
You definitely need to be flexible and adaptable. Given the environment, the regime is governed by the prison, so sometimes it can be difficult to get access to the prisoners. So you need to be innovative in the way that you deliver healthcare sometimes.
I think it's really important as well to be non-judgmental. You're working with a wide selection of people with all sorts of different backgrounds. Ultimately, we're there to deliver a service, and I think to do that effectively, you need to be non-judgmental.
What shifts are available?
So Bristol Community Health place a lot of value on being family friendly and flexible. Only 2 of our sites require night work, and some of our teams only work Monday to Friday and don't require weekend work-in. So there's definitely scope to find a role there that suits you and your needs outside of work.
I think the chance of doing bank shifts is also good for work-life balance, because it gives you the opportunity to work the days that you want to do, or overtime if you feel you want to do any overtime work.
How can I find out more about working in prison healthcare?
We've got regular open days where you can come and meet the staff there and also experience the environment.
You can also do shadow shifts if you want, to see how we work on a day-to-day basis.
What do you get out of your job role?
For me, as clinical lead, what I get out of my job role is sharing and expanding the clinical knowledge within the teams.
It's a nice feeling that you know that during your day at work you've actually made a difference to someone's life, and it's really rewarding.
The patient engagement is really rewarding because the population are so usually disadvantaged in terms of coming from social economic backgrounds, and then they're in an environment then which is very difficult. So when you are able to help someone, it does just feel so much more like you've achieved something.
For me personally, I get a massive sense of achievement from doing what I do. Clearly get to see the results from making a difference to just an individual, if you like. So to go home at the end of the day knowing that you've actually achieved something and you've made a difference to that person's life is really humbling.